On the Health Products Regulatory Body, SAHPRA, has cautioned against the use of several contaminated children's medication that have made their way to South Africa. This follows the deaths of 33 children in the Gambia. Authorities say the drugs contain ingredients that may be poisonous. Joining us now to explain the alert is Kuda Kapfumvuti, Senior Manager of Health Products Authorisation at the South African Health Products Regulatory Authority. Kuda, good evening. Good to have you with us, and thank you very much for your time. Are you reacting to the alert by the WHO on the potential harmful effects of these products, or have you done your own internal probe into their existence in the country, as WHO warns that the exposure could have gone far beyond the Gambia?
Good evening, Thabo, and good evening to all the viewers. Thank you for having me. So SAHPRA, that is the regulator, South African Health Products Regulatory Authority, is received a medical product alert, just like any other regulatory authority globally, regarding substandard products that have been identified in the Gambia. So just to correct you there, we haven't received any alert in the country regarding these relevant products.
So yourself, you have not conducted a probe on whether or not the 4 products are currently in circulation in the country?
So we at SAHPRA, we have a mechanism in terms of detecting any such medicines that find their way in the country. So the mechanism is in place. We haven't actually received any alert in that regard.
Okay, so talk to us then about why you are issuing this particular caution.
Sorry, I missed you quite a bit.
Why are you as SAHPRA then issuing a caution for the residents of South Africa?
Yes, so we have to. Once we receive such alerts, as a regulator, we also have to issue such alerts, because we are cognizant of the fact that even though there is no alert locally in the country regarding these substandard medicines, they might find their way in the country. Or we also know that there are people that may be traveling into the country. So having that alert is of paramount importance.
Yeah. How often does that happen, where a product that has not been tested sufficiently for quality and safety would make its way into the country and would be used widely?
So like I said, we have a mechanism. So we will detect such cases if or when they are to happen. And we also have requirements that all importers are actually required to do what we call post-importation testing. So all products that are supposed to be exported into the country, they are required to be tested before they are released for consumption by the public.
Yeah. And such an arrangement exists with all countries, be it India, be it Gambia, be it wherever, where this product could have made its way into the country. Are you saying your system is foolproof like that?
Yes, so our system is very robust. So should anyone had wanted to import these medicines into the country, the system is robust. We can detect that. We've got a regulatory compliance unit at the regulator, at SAHPRA, that is actually involved in these activities. So we have a system in place, we have a mechanism in place to ensure that we detect such activities happening. So we can confirm that we don't have those products in the country.
So from a health and safety point of view at SAHPRA, the amounts of diethylene and ethylene glycol that is said to be in this product, what could be the impact of that?
Did you say what could be the impact?
Yes.
Did I hear you correctly?
Yes.
Okay, so diethylene glycol and ethylene glycol, these are toxic to humans. So once they find their way in any medicine, they have proven to be very fatal. They cause quite significant side effects that include vomiting, diarrhea, and injury-related diseases that are related to kidney diseases. So those substances, chemicals, are poisonous if they are ingested. If they are in medicines and they're ingested by humans.
Yeah. And for that reason, you are saying South Africans who could come across these products, what exactly should they do?
So if any South African is in possession of such products, okay, or if they come across such a product, they should stop using those products, and neither should they continue administering those products to children, because they have been identified as substandard. They are actually having toxic side effects that are linked with them. So what they need to do is they need to report to our regulatory compliance unit or department. It's SAHPRA. The contact details can be found on the website. So our regulatory compliance department is responsible for actually monitoring and tracking such issues.
Yeah. You of course, Senior Manager for Health Products Authorisation, would I suppose know what would be the sanction that would be, for example, attached to somebody who would be distributing such medication without the necessary authorization?
Yes. So ordinarily speaking, the public is actually encouraged to purchase medicines from licensed people and licensed premises. So if they are found to be in possession of such medicines, it means they have actually gone against the law. And like I said, the regulatory compliance unit actually is involved in actually monitoring these activities, and they work in collaboration with the law enforcement agencies where such cases are actually seen to be occurring.
Yeah. So you're saying if somebody, for example, were to be coming from outside of South Africa and would have acquired this product elsewhere, because as WHO says, right now there seems to be an indication that this product has circulated beyond the Gambia, that person found in possession of this product would have committed a criminal offense in the country?
Yes, so ordinarily, if someone is to bring medicines into the country, they have to do it in the lines of law. So you're not supposed to just bring in medicines. There's actually some Port Health release that is linked to ensuring that medicines are released in the country. So yes, if you are to bring medicine in the country, there's customs officials at the ports, and there's Port Health officials that are also monitoring the movement of medicines. So it is against the law to actually bring in medicines, and they are actually released. They shouldn't be released actually if they are coming into the country, because there are actually laws that ensure that relevant medicines can be released to the public.
Over and above the alert that you have given out in the country and, of course, the monitoring and evaluation system that is in place, is there more other work that you're going to be doing in terms of investigations and a probe into this matter?
So as the regulator, we continue to be vigilant. We continue to have surveillance and our ears and eyes on the ground. So based on this alert, definitely we, like I said, if anyone is in possession, they should report that. If they've come across this medicine or in possession, they should also report. That way, it's a collaborative effort as well. The general public, the healthcare professionals, healthcare facilities, everyone is a duty for us to make sure that we have public safety as a matter of priority. So that's all I can say.
Yeah. And for the benefit of our viewers, maybe, I don't know if you yourself have gotten sight of these products. What do they look like, and how would they know this is promethazine, this is rofuxmelin, this is Markov, or this is Magrin?
Yeah, so the pictures are circulating. They are available for all to see. The packaging is clear. Unfortunately, I can't show at this interview, but the pictures are actually available. If anyone would like to reach out to the regulator, we can always provide that information. But the images have been circulated, and they are very clear and to see exactly what these products look like.
We appreciate your time, and thank you very much for coming on. Kuda Kapfumvuti, Senior Manager of Health Products there.